Hi, my name's John Green. I write books and also I make YouTube videos with my brother Hank, and over the last decade, the community that built up around those videos has worked on a number of projects with partners in health. From Haiti to Peru to Rwanda, we have seen how PIH helps improve healthcare systems in impoverished communities, and today we're asking you to join us in supporting PIH as they work to transform healthcare access in Sierra Leone, which has the highest maternal mortality rate in the world. Around 1 in 17 women in Sierra Leone can expect to die in pregnancy or childbirth. 1 in 17. They die from undiagnosed high blood pressure, and they die from hemorrhaging, which any well-stocked hospital could easily prevent. They die because there is no electricity to keep the lights on during nighttime deliveries, or to keep blood for transfusions refrigerated. Or they die because in many clinics there is no running water, which makes it difficult to prevent infection. They die due to lack of surgical gloves and lack of medications, and they die every single day for want of a safe cesarean section. In Sierra Leone, needing a C-section is a life-threatening emergency for many women. A woman delivering at home or at a local clinic will usually find that there is no ambulance to take her to the hospital, and so her best chance will be a long ride, dying on the back of a motorbike. This is a crisis. It is an emergency, but because it is an emergency that has been unfolding for many years, it doesn't receive much attention. But also, the solution isn't easy. It isn't ambulances or electricity or water or medications. It's ambulances and electricity and water and medications and much more, because the entire system needs to get stronger. And that's what Partners in Health is really good at. Working closely with the Sierra Leonean Ministry of Health, they are crafting a plan to strengthen every facet of the healthcare system, beginning in the Kono district. That means hiring more community health workers who can make house calls to people with high-risk pregnancies or those living with chronic illnesses, and it means strengthening primary care centers so people can receive good basic care. And it also means the creation and support of the Maternal Center of Excellence at Koidu Government Hospital, which will have a NICU and more operating rooms, and will also serve as a teaching hospital to help train the next generation of Sierra Leonean healthcare workers. 96% of Partners in Health Sierra Leone's employees are Sierra Leonean, and I have seen what they've been able to accomplish through their commitment to their patients despite extremely limited resources. Even in clinics without running water or electricity, children are still getting vaccinated, people with tuberculosis and HIV are still receiving treatment, but it's not nearly enough. 10% of kids in Sierra Leone die before they turn 5. And pregnancy continues to be far too often a life-threatening condition. To radically reduce maternal and child mortality in Sierra Leone, we need your support. This is a long-term problem, and it requires a long-term solution. That's why our family has made an ongoing pledge to support this effort. And we're hoping that you will join us. If you can donate $5 a month, or I don't know, $50 or $500 a month, it will really help. PIH is known for their efficiency and their effectiveness, so I hope you'll consider making a donation right now. I'm sure there are donate links all over this page. You can just click one. I'm often asked why Sierra Leone, and to me there are many answers to that question. It is the epicenter of maternal death in the world. The Ministry of Health is committed to making system-wide change, and Partners in Health's deep connections in Kono allow it to facilitate that change. But also, when we imagine the problems of the world's poorest communities as entirely separate from our problems, we make a them of the world's most vulnerable people. And I don't want to do that. Which brings me to my last request. Having asked you for money, I also need to ask you for something else. Your attention. The most valuable commodity of all. Together, over the next several years, we're going to be able to follow the successes and challenges of this project through podcast and photo and video updates from Kono and through interviews with Sierra Leonean healthcare workers. Whether you can donate or not, please know that paying sustained attention to the structural system-wide challenges of poverty really can lead to change, because we only address the injustices we see. Again, I hope you'll consider making a donation to Partners in Health Sierra Leone today. Thank you for being here, and as they say in my hometown, don't forget to be awesome.